Dear friends, let us discuss a topic: hybrid muscles or muscles of dual innervation. They are also known as composite muscles. It's a small topic, but it is of importance as MCQs. These are having more than one set of muscle fibers. That's why they are called composite muscles or hybrid muscles, but they perform the same function. They are separated by different nerves for different set of fibers. That's why they have dual innervation. And what is the basis? There is a developmental basis for it. Because of fusion of two different muscular masses or muscle primordia during development, one a ventral or flexor muscle mass and a dorsal or extensor muscle mass, each one receiving its innervation from the ventral divisions or from the dorsal divisions of a plexus, let it be brachial plexus or lumbosacral plexus for the upper and lower ribs respectively. This is one example. Then what are the advantages of it? This dual innervation. Sparing of a muscle during approach along one aspect. That is the advantage of this dual innervation. Let us see examples of muscles of upper limb with dual innervation. So they are the brachialis muscle. If you recollect, the front of arm muscles, they are all flexors and they are the biceps brachii, coracobrachialis and brachialis. All are innervated by musculocutaneous nerve. The peculiarity of brachialis is it is separated by both musculocutaneous nerve, which is a branch from the lateral cord of brachial plexus, and which is formed by the union of the ventral divisions. And this is a motor nerve supply for it. And it also receives a branch from the radial nerve, which is formed from the posterior cord, and it is proprioceptive. And the advantage of having this dual innervation, as I mentioned, during the surgical procedures, when there is anterior approach for the arm, the brachialis muscle is longitudinally split. The medial one having the supply from the lateral cord of brachial plexus, that is the musculocutaneous nerve, and the lateral one receiving from the radial nerve. Then the other example for it is the flexor digitorum profundus, which is having forceps. The radial half of it is separated by the median nerve and the medial half is by the ulnar nerve. So this is an example for dual innervation, and which can come as an MCQ for you. Then there is the flexor pollicis brevis muscle. It is separated by two nerves. One is the recurrent branch from the medial nerve, other is the deep branch of ulnar nerve. This is occasional dual innervation. Subscapularis is the other example for the upper limb, which is separated by the upper and lower subscapular nerves, which are branches from the posterior cord of brachial plexus. Then coming to the pectoralis, major muscle, which is on the ventral aspect of the thoracic wall, and it is separated by both medial and lateral pectoral nerves, which are coming from the ventral divisions of the brachial plexus. Hope you have understood the explanation for the dual innervation for the muscles of upper limb. Let us see the lower limb muscles with dual innervation. One is the adductor magnus muscle. It has got two parts, adductor part which belongs to the adductor compartment and is separated by the obturator nerve. So the posterior division of obturator nerve supplies the adductor part, and it has got a hamstring part which takes origin from the ischial tuberosity, and that part is innervated by tibial part of sciatic nerve along with the other muscles, that is part of biceps femoris, semitendinosus and semimembranosus muscles. Then the other example is the biceps femoris muscle, which has got two heads, long head and short head. The long head is the hamstring part and it is separated by the tibial component of sciatic nerve, whereas the short head is separated by the common peroneal component of the sciatic nerve. Then coming to the pectineus muscle. This is also having two parts, an anterior part which is separated by the femoral nerve of the anterior part of thigh or the front of thigh. Then the other one is from the medial part, that is the obturator nerve will be supplying it. The anterior division of obturator nerve will supply it. Then the next one is the iliopsoas muscle. It has got the iliacus and psoas muscles. So the iliacus part is separated by femoral nerve, whereas psoas part is separated by the anterior rami of L1, 2, 3 spinal nerves. Now let us see the muscles of head and neck with dual innervation. If you take the tongue, the musculature of tongue, as all of you know, there is intrinsic muscles and extrinsic muscles, and development of tongue, you know, and then the musculature of the tongue, they are derived from the occipital myotomes, which are separated by the hypoglossal nerve. So the hypoglossal nerve is supplying all the intrinsic and extrinsic muscles of the tongue except the palatoglossus, which is separated by the vagus through the cranial part of accessory and through the pharyngeal plexus. So that's why we can call it as the muscle with dual innervation. The musculature of tongue is with dual innervation. Then the other example is the digastric muscle, which is having two bellies, an anterior belly and posterior belly. Both the bellies, they are developing from different pharyngeal arches. The anterior belly is coming from the first arch, muscle of first arch. So the nerve of first arch will supply it, that is the nerve to mylohyoid. So the mandibular division of the trigeminal nerve is supplying it. Then coming to the posterior belly, it is derived from second arch. The nerve of second arch is the facial nerve. So facial nerve is supplying the posterior belly of digastric. The third one is the sternomastoid muscle. So it has got dual innervation and it is separated by motor innervation from the accessory cranial nerve, that is the 11th cranial nerve. Then the other one is the proprioceptive, like the brachialis muscle in the upper limb. So it is derived from the cutaneous branch, cervical plexus. So now you know the muscles with dual innervation in the upper limb, lower limb and head and neck. Hope this is useful for you.